Dear students, we shall continue now with arteries, veins and lymph vessels of the upper limb. The axillary artery is a direct continuation of the subclavian artery beyond the outer border of the first rib. It gives off branches in the axillary fossa and then continues at the brachial artery. It supplies the muscles of the shoulder joint, muscles bordering the axillary fossa, deltoid, lateral thoracic wall, including its muscles and the mammary gland. The axillary artery can be divided into three parts according to its relationship with the pectoralis minor. The first part is proximal to pectoralis minor, the second part is posterior to pectoralis minor, and the third part is distal to pectoralis minor. As the artery passes through the axilla, it is surrounded by the cords and branches of the brachial plexus. The axillary artery gives 6 branches, 1 branch from first part, 2 branches from the second part, and 3 branches from the third part. Most of these branches go to and supply walls of the axilla. From first part we have superior thoracic artery. It is a very small branch, arises near the subclavius, passes between the pectoralis major and minor muscles, and supplies these muscles and medial wall of the axilla. From second part we have thoracoacromial artery and lateral thoracic artery. Thoracoacromial artery emerges at the upper border of pectoralis minor, pierces clavipectoral fascia, and soon breaks up into 4 branches: pectoral branch, deltoid branch, acromial branch, and clavicular branch. These branches radiate at right angle to each other. The pectoral branch supplies pectoral muscles, deltoid branch ends by joining anastomosis over the acromion, and clavicular branch supplied sternoclavicular joint. Lateral thoracic artery emerges at and runs along the inferior border of pectoralis minor, supplying the pectoralis major and minor and serratus anterior muscles. In the females, the lateral thoracic artery is large and provides important supply to the breast through its lateral mammary branches. From third part we have subscapular artery, anterior and posterior circumflex humeral arteries. Subscapular artery is the largest branch of axillary artery, runs along the lower border of the subscapularis, and ends near the inferior angle of the scapula. It gives a large branch, the circumflex scapulary artery, which passes through upper triangular intermuscular space, winds round the lateral border of scapula to enter infraspinous fossa. It gives numerous small branches. Anterior circumflex humeral artery is a small branch, passes in front of surgical neck of humerus, and anastomoses with the posterior circumflex humeral artery to form an arterial circle around the surgical neck of humerus. It gives an ascending branch which runs upwards into the intertubercular sulcus of humerus to supply the head of humerus and shoulder joint. And last, posterior circumflex humeral artery is larger than anterior circumflex humeral artery, passes backwards along with the axillary nerve through the quadrangular intermuscular space, crosses the posterior aspect of surgical neck of humerus to anastomose with the anterior circumflex humeral artery. It supplies the deltoid muscle and shoulder joint. We can repeat now axillary artery. The axillary artery is a continuation of the subclavian artery below the inferior margin of the first rib. The brachial artery is a direct continuation of the axillary artery below the inferior margin of the teres major. We have 3 parts of the axillary artery. Suprapectoral part originates from the subclavian artery when it's crossing the lateral margin of the first rib. Retropectoral part descending behind the tendon of the pectoralis minor, An infrapectoral part is located between the inferior margin of the pectoralis minor and the inferior part of the teres minor and latissimus dorsi. The branches of axillary artery are superior thoracic artery, thoracoacromial artery, lateral thoracic artery, subscapular artery, and anterior and posterior circumflexhumeral arteries. The axillary pulse is commonly felt in the axilla. The brachial artery is the continuation of the axillary artery. When the axillary artery reaches the lower border of the teres major, it becomes the brachial artery. The brachial artery is the main source of the blood for the arm. Branches of brachial artery are muscular branches, deep brachii artery, nutrition artery, superior ulnar collateral artery, inferior ulnar collateral artery, and radial and ulnar arteries. Muscular branches supply the anterior compartment of the arm. Deep brachii artery or profunda brachii artery is the largest and first branch. It arises from the posteromedial aspect of the brachial artery just below the lower border of the teres major. It accompanies the radial nerve, with which it immediately leaves the lower triangular intermuscular space to enter the spiral groove on the posterior surface of the humerus. Nutrition artery to humerus enters the nutrition foramen of humerus, located near the insertion of coracobrachialis. Superior ulnar collateral artery arises near the middle of the arm and accompanies the ulnar nerve. Inferior ulnar collateral artery or supratrochlear artery arises near the lower end of humerus and divides into the anterior and posterior branches, which take part in the formation of arterial anastomosis around the elbow. The terminal branches of brachial artery are radial and ulnar arteries. We can repeat now that the brachial artery originates from the axillary artery close to the inferior margin of the teres major at the level of the surgical neck of the humerus and descends on the medial surface of the arm to the cubital fossa. The first branch of the brachial artery is deep artery of arm or profunda brachial artery, which runs between the lateral and medial heads of the triceps and then passes in the radial groove with the radial nerve. The branches of the deep artery of the arm are deltoid branch, which supplies the deltoid muscle, middle collateral artery, which enters the medial head of the triceps, and radial collateral artery, which terminates in the cubital articular anastomosis. The next branch is humeral nutrition artery. Next one is superior ulnar collateral artery, which descends on the anterior surface in the medial intermuscular septum of the arm with the ulnar nerve and terminates in the cubital articular anastomosis. The next one is the inferior ulnar collateral artery, which arises just above the cubital fossa and enters the cubital articular anastomosis. The cubital articular anastomosis is a vascular plexus of the elbow joint, formed by the brachial, radial, and ulnar arteries. The brachial pulse is commonly felt in the cubital fossa, medial to the tendon of biceps, and its pulsations are auscultated for the recording the blood pressure. The biceps tendon is easily palpable on flexing the elbow. The radial artery is the smaller terminal branch of the brachial artery. It begins in the cubital fossa at the level of the neck of the radius. It passes downwards to the wrist with lateral convexity. In the upper part, it lies beneath the brachioradialis on the deep muscles of the forearm. In the distal part of the forearm, it lies on the anterior surface of the radius and is covered only by the skin and fascia. The superficial radial nerve lies lateral to the middle one-third of the radial artery. The radial artery leaves the forearm by winding around the lateral aspect of the wrist to reach the anatomical snuff box on the posterior surface of the hand. Radial pulse is felt on the radial side of the front of wrist, where the radial artery lies on the anterior surface of the distal end of radius, and covered only by the skin and fascia. At this site, the radial artery lies between the tendon of flexor carpi radialis medially and tendon of brachioradialis laterally. While examining the radial pulse, thumb should not be used because it has its own pulse, which may be mistaken for patient's pulse. The radial pulse is commonly used for examining the pulse rate. Branches in the forearm are muscular branches to the lateral muscles of the forearm. Radial recurrent artery arises in the cubital fossa and takes part in the formation of arterial anastomose around the elbow joint. Palmar and dorsal carpal branches arises near the wrist and anastomosis with the palmar carpal branch of the ulnar artery. Superficial palmar branch arises just above the wrist and enters the palm of the hand by passing in front of the flexor retinaculum. It joins the terminal part of the ulnar artery to complete the superficial palmar arch. We can repeat now the branches of the radial artery. Muscular branches supply the lateral muscles of the forearm. Radial recurrent artery heads proximally to the cubital articular anastomosis. Palmar carpal branch terminates in the palmar carpal articular anastomosis. Superficial palmar branch runs between the tenor muscles and participates in the formation of the superficial palmar arch. Dorsal carpal branch arises at the anatomical snuff box and gives branches supplying the dorsum of the hand. First dorsal metacarpal artery divides into the dorsal digital artery supplying the thumb and lateral side of the forefinger. First palmar metacarpal artery arises where the radial artery enters the palm and divides into the palmar digital arteries, which supply both margins of the thumb and the lateral margins of the forefinger. Radial artery enters the palm and divides into its terminal branches, deep palmar arch and princeps pollicis artery. In the hand, the ulnar and radial arteries interconnect to form two arches, from which branches to the digits emerge. Radial artery contributes mainly to supply of the thumb and the lateral side of the index finger. The ulnar artery is the larger terminal branch of the brachial artery. It begins in the cubital fossa at the level of the neck of the radius. It runs downwards and reaches the medial side of the forearm, midway between the elbow and wrist. In the upper one-third of forearm, the course is oblique, but in lower two-thirds it is vertical. The median nerve lies medial to the artery 2.5 cm distal to the elbow and then crosses the artery. The ulnar nerve lies medial to the distal two-thirds of the artery. Ulnar artery enters the palm by passing in front of flexor retinaculum lateral to the ulnar nerve and the pisiform bone. It terminates in the hand by dividing into large superficial and small deep branches. Branches of the ulnar artery are muscular branches to the muscles, anterior and posterior ulnar collateral or recurrent arteries, which take part in the arterial anastomosis around the elbow joint. Common interosseous artery, which arises from the upper part of the ulnar artery and after a very short course at the upper border of the interosseous membrane, it divides into anterior and posterior interosseous arteries. Anterior and posterior ulnar carpal branches, which take part in the formation of anterior and posterior carpal arches. terminal branches are two. The largest superficial branch continues as the superficial palmar arch, while the smaller deep branch joins the deep palmar arch. In the hand, the ulnar and radial arteries interconnect to form two arches. The radial artery contributes mainly to supply of the thumb and the lateral side of the index finger. Ulnar artery contributes mainly to the supply of the rest of the digits and the medial side of the index finger. Superficial palmar arch is formed by an anastomosis between the larger trunk of the ulnar artery and the smaller superficial palmar branch of the radial artery. Branches of the superficial palmar arch are common palmar digital arteries which descend distally between the metacarpals. Branches of common palmar digital arteries are proper palmar digital arteries which arising at the level of the metacarpal heads that run along the side of the fingers. Deep palmar arch is formed by an anastomosis between the larger terminal branch of the radial artery and the smaller deep palmar branch of the ulnar artery. The branches of deep palmar arch are palmar metacarpal arteries which supply the fingers, head distally and anastomose with the common digital arteries. You can see here that the both radial and ulnar arteries send a dorsal carpal branch to the dorsum of the hand where they communicate. The radial branch is usually stronger and predominantly supplies the dorsal metacarpal arteries for the dorsum of the hand and dorsal digital artery for the digit up to the proximal interphalangeal joints. The intermedial and distal phalanges are supplied by the palmar digital arteries. We shall repeat now that the axillary pulse is commonly felt in the axilla. The brachial pulse is commonly felt in the midarm and in the cubital fossa. The radial pulse is commonly felt in the distal forearm and in the anatomical snuff box, and the ulnar pulse is commonly felt in the distal forearm. In this picture, you can learn and repeat all major arteries. You can see the branches of the axillary artery, branches of the brachial artery, and branches of the radial and ulnar arteries. The veins of the upper limb are divided into two groups, superficial and deep. The superficial veins are located in the superficial fascia and are easily accessible. Being easily accessible, they are frequently used by the clinicians for taking the blood samples or for giving intravenous injections. The deep veins lie deep to the muscles and accompany arteries as in Latin vene comitantes. Superficial veins of the upper limb are cephalic vein, basilic vein, median cubital vein, and median vein of the forearm. Cephalic vein, or in Latin vena cephalica, arises from the lateral side of the dorsal venous network of hand, ascends on the radial side of the forearm to the elbow, and then in the lateral side of biceps, continues up the arm in the delta pectoral groove, and then to the infraclavicular fossa, where it pierces clavipectoral fascia to drain into axillary vein. Basilic vein, or in Latin vena basilica, arises from the medial side of the dorsal venous network of hand, ascends on the ulnar side of forearm to the elbow to middle of the arm, where it pierces the deep fascia and joins the brachial vein or axillary vein. Median cubital vein, or in Latin vena mediana cubiti, is a communicating venous channel between the cephalic and basilic veins, which shunts blood from cephalic vein to the basilic vein. It begins from the cephalic vein, runs obliquely upwards and medially to end in the basilic vein above the elbow. Median vein of the forearm, or in Latin vena mediana antebrachi, begins from palmar venous network, runs upward in the midline and the anterior aspect of forearm to end in any one of three veins in front of elbow: cephalic, basilic, and median cubital veins. Sometimes the upper end of median vein of the forearm divides into median cephalic and median basilic veins, which join the cephalic and basilic veins. In this situation, the median cubital vein is absent or is very small and tiny. The veins in front of the elbow commonly form two patterns: H-shaped pattern or M-shaped pattern. The deep veins comprise accompanying veins, or in Latin venae comitantes, which accompany the large arteries such as radial, ulnar, and brachial arteries, accompanying veins of the brachial artery, and only one axillary vein. Accompanying veins of the radial and ulnar arteries accompany the radial and ulnar arteries and join to form the brachial veins. Accompanying veins are small veins, one of each side of the brachial artery. They join axillary vein at the lower border of the teres major muscle. The medial one often joins the basilic vein. Axillary vein begins as a continuation of basilic vein at the lower border of the teres major muscle and runs through axilla, passes through its apex to continue as subclavian vein at the outer border of the first rib. When you know the arteries of the upper limb, it's easy to remember names of the deep veins of the upper limb. From dorsal venous network of hand, lateral we have two radial veins and medially we have two ulnar veins. Two radial veins fuse and form lateral brachial vein. Two medial ulnar veins fuse and form medial brachial vein. Together, lateral and medial brachial veins fuse and form only one axillary vein. Superficial, under the skin, lateral we have cephalic vein and medial we have basilic vein. Cephalic vein and in the axillary vein, and basilic vein and in the brachial vein. We have one anastomotic vessel between cephalic and basilic vein. It is median cubital vein. The lymphatic drainage of the upper limb follows the unnamed lymph vessels which originate in the hand and run upwards towards the axilla. When they reach cubital fossa, the lymph passes through cubital nodes. From here, lymph vessels run superiorly to drain into the axillary lymph nodes. The lymph vessels draining the lymph from the upper limb are divided into two groups: superficial and deep. The superficial lymph vessels are located in the subcutaneous tissue. They curve upwards toward the axilla. Most of them end in the axillary lymph nodes. Those from lateral side of the limb and lateral 2 digits follow the cephalic vein and drain into the infraclavicular lymph nodes. Those from medial side of the limb and medial 3 digits follow the basilic vein and drain into the lateral groove of axillary nodes. A few lymph vessels drain the thumb and in the deltopectoral lymph nodes. The efferents from these nodes pierce the clavipectoral fascia to drain into the apical group of axillary nodes. The deep lymph vessels drain structures lying deep to the deep fascia and muscles. The deep lymph vessels curve along the arteries and drain into the lateral group of the axillary lymph nodes. Superficial lymph nodes are infraclavicular nodes, dectopectoral node, and superficial cubital nodes. The deep lymph nodes are axillary lymph nodes on the medial side of the brachial artery, and in the cubital fossa. The axillary lymph nodes divided into 5 groups. Anterior or pectoral group lie along the lateral thoracic vein at the lower border of the pectoralis minor. Posterior or subscapular group lie on the posterior axillary fold along the subscapular vein. Lateral group lie along the upper part of the humerus in relation to the axillary vein. Center group are situated in the upper part of the axilla. Apical or infraclavicular group are situated deep to the clavipectoral fascia at the apex of the axilla along the axillary vein. They are of great clinical importance because they receive lymph directly from the upper part of the breast. They drain into subclavian lymph trunk on the right side and into the thoracic duct on the left side. The lymph nodes first receive the lymph from the area of the breast involved in the cancer are termed sentinel lymph nodes. The inflammation of the lymph vessels usually follows trivial injuries to any part of the upper limb. In acute inflammation, the lymph vessels may be seen underneath the skin as red streaks which are tender. The axillary lymph nodes are enlarged and become painful following infection in any part of the upper limb. Now we have to repeat lymph vessels. Left we have superficial lymph vessels, right we have deep lymph vessels. In the left picture you can see how the superficial lymph vessels follows the superficial veins, and in cubital fossa we have deep cubital nodes. Right, in axilla we have deep axillary nodes. Dear students, questions and suggestions you can send me by email.